Good day, I am Trixie Filias Rutiliano, and today I'm going to perform the return demonstration of assessing the neurological system. So the basic concept of this assessment is that it is an examination of the neurologic system which comprises the assessment of the mental status, including the level of consciousness, the cranial nerves, reflexes, motor, and sensory functions. Some parts of the neurologic assessment are performed throughout the health assessment like mental status assessment, observing the appearance and cranial nerve functions. So the objectives are to obtain an accurate nursing history of the client's neurologic system, to determine any deviations or abnormal findings of the client's nervous system functioning, and lastly, to formulate valid nursing diagnosis, collaborative problems, and or referrals. In preparation to this assessment, first we're going to assemble our equipment. So we have sugar, salt, lemon juice, quinine flavors, percussion hammer, tongue depressors, one broken diagonally for testing pain sensation. Then we will introduce ourselves and verify the client's identity. Explain to the client what we are going to do, why it is necessary, and how the client can cooperate. So, good day, ma'am. I am Nurse Orteliano. Can I confirm your identity?
I'm Hanalyn Calderon.
Thank you, ma'am. So, this assessment will be, I am your nurse for today, assisting you in assessing your neurologic system. This is for our baseline purposes, and this procedure may take a while, but I want to ask you to, if you can cooperate with me, if that's okay with you, ma'am.
Yes.
Thank you. Then, we will perform hand hygiene and observe other appropriate infection control procedures. Then, we will provide for client privacy. So now, we will proceed to the procedure. First, we will inquire if the client has any history of the following: presence of pain in the head, back, or extremities, as well as onset and aggravating and alleviating factors, disorientation to time, place, or person, speech disorders, any history of lost consciousness, fainting, convulsions, trauma, tingling or numbness, tremors or tics, limping, paralysis, uncontrolled muscle movements, loss of memory or mood swings. Also, problems with the senses, which are smell, vision, taste, touch, or hearing. Also, if the client displays difficulty speaking, we will do this. So we will ask the client, we will point to common objects and ask the client to name them. So, ma'am, can you name these objects?
A key, a coin.
Thank you, ma'am. Also, we will ask the client to read some words and match to the printed and written words with pictures. So, ma'am, can you read this first sentence?
The respiratory system provides oxygen to the body, disposes of carbon dioxide, and helps circulate blood.
Thank you, ma'am. We will also ask the client to respond to simple verbal and written commands. So, ma'am, can you raise your right arm, your left arm, and also can you point your toes? Thank you, ma'am. So, next, we will assess for the orientation of the client. Determine the client's orientation to time, place, and person by tactful questioning. We will ask the client these following questions. So, ma'am, where do you live?
District 8, Farangay City, Pagkasundan Norte.
Thank you, ma'am. What time is it today?
9 p.m.
What is the date today?
August 2,
What is the day of the week today?
Monday.
Thank you, ma'am. And also, we will ask for the ma'am, what is the name of your mother?
Nagaling Calderon.
And for your father?
Julie Calderon.
Thank you, ma'am. So, more direct questioning might be necessary for some people. Like, where are you now and what day is it today? So, proceed now to the memory. We will listen for lapses and memory. We will ask the client about difficulty with memory. If problems are apparent, 3 categories of memory are tested. So, immediate recall, recent memory, and remote memory. To assess immediate recall, we will ask the client to repeat a series of 3 digits spoken slowly. So, ma'am, can you repeat these numbers? 743
743
56
56
72.
72.
Can you combine those numbers?
743 56 72.
And also, we will start again with a series of 3 digits. But this time, we will ask the client to repeat them but backwards. So, ma'am, can you state these numbers in a backward manner? So, 312,
213
34,
42
and 32.
23
Can you combine all those numbers in a backward manner?
23 43 213.
Thank you, ma'am. So, the average person can repeat a series of 5 to 8 in sequence and 4 to 6 in reverse order. So, to assess recent memory, we will ask the client to recall the recent events of the day, such as how he got to the clinic. This information must be validated. We will also ask the client to recall information given early in the interview, like the name of the doctor. And also, we will provide the client with 3 facts to recall, like a color, an object, an address, or a 3-digit number, and ask the client to repeat all 3. Later in the interview, we will ask the client to recall all 3 items. So, ma'am, there are objects I seen you earlier. So, can you recall those objects?
Key, coin.
Thank you, ma'am. Then we will also ask the client to describe a previous illness or injury. So, ma'am, have you undergone a brain surgery before?
No.
Thank you, ma'am. So, in attention span and calculation, we will test the ability to concentrate or attention span by asking the client to recite the alphabet or to count backwards from 100. So, ma'am, can you recite the alphabet letters from A to Z?
A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P, Q, R, S, T, U, W, X, Y, and Z.
Thank you, ma'am. Then we will also test the ability to calculate by asking the client to subtract 7 or 3 progressively from 100. So, ma'am, can you start from 100 by subtracting 7?
100, 92, 86, 79.
And so on. Then, next, we will also test the level of consciousness. So, we will apply the Glasgow Coma Scale, eye response, motor response, and verbal response. For the cranial nerves, we will test the cranial nerves. The cranial nerve 1, which is the olfactory, ask the client to close eyes and identify different mild aromas such as coffee and vanilla. For the cranial nerve 2, which is the optic, we will ask the client to read Snellen's chart, check visual fields by confrontation, and conduct an ophthalmoscopic examination. Then for the cranial nerve 3, which is the oculomotor, we will assess ocular movements and pupil reaction. In cranial nerve 4, the trochlear, we will assess 6 ocular movements. And cranial nerve 5, the trigeminal, we will, while the client looks upward, we will likely touch the lateral sclera of the eye to elicit the blink reflex. To test light sensation, have the client close eyes and wipe a wisp of cotton over client's forehead and paranasal sinuses. To test deep sensation, we will use alternating blunt and sharp ends of a safety pin over the same area. For the cranial nerve 6, the abducens, we will assess directions of gaze For the cranial nerve 7, facial nerve, we will ask the client to smile, raise the eyebrows, frown, puff out cheeks, and close eyes tightly. We will also ask the client to identify various tastes placed on the tip and sides of tongue, sugar, salt, and to identify areas of taste. For the cranial nerve 8, the auditory, we will assess the client's ability to hear the spoken word and the vibrations of a tuning fork. For the cranial nerve 9, the glossopharyngeal, we will apply taste on the posterior tongue for identification. We will ask the client to move tongue from side to side and up and down. For the cranial nerve 10, the vagus or vagus, we will assess with cranial nerve 9. Assess the client's speech for hoarseness. Cranial nerve 11, the accessory nerves, we will ask the client to shrug shoulders against resistance from our hand and to turn head to the side against resistance from our hand. Repeat for the other side. And lastly, for the cranial nerve 12, the hypoglossal, we will ask the client to protrude tongue at midline, then move it side to side. So, we will proceed now in assessing for reflexes. We will test reflexes using a percussion hammer, comparing one side of the body with the other to evaluate the symmetry of response. First, we will assess for the biceps reflex. We will test the spinal cord level C5 and C6. So, we will partially flex the client's arm at the elbow and rest the forearm over the thighs, placing the palm of the hand down. So, flex your arms. Thank you. Then we will place the thumb of our non-dominant hand horizontally over the biceps tendon. We will deliver a blow, a slight downward thrust with the percussion hammer to our thumb. So we will observe the normal slight flexion of the elbow and feel the biceps contraction through our thumb. Also for the other hand. Then for the triceps reflex, this will test the spinal cord level C7 and C8. We will flex the client's arm at the elbow and support it in the palm of our non-dominant hand. We will palpate the triceps tendons about 2 to 5 cm or 1 to 2 inches above the elbow. So ma'am, can you flex that? Then we will deliver a blow with the percussion hammer directly to the tendon. So we will observe for the normal slight extension of the elbow. Also for the other hand. So, we will proceed for the brachioradialis reflex. This will test the spinal cord level C3 and C6. So, we will rest the client's arm in a relaxed position on your forearm or on the client's own leg. Then, we will deliver a blow with the percussion hammer directly on the radius 2 to 5 cm or 1 to 2 inches above the wrist or the styloid process, the bony prominence on the thumb side of the wrist. So now, we will observe the normal flexion and supination of the forearm. The fingers of the hand might also extend slightly. So, also for the other hand. Thank you, ma'am. So, for the patellar reflex, this will test the spinal cord levels L2, L3, and L4. We will ask the client to sit on the edge of the examining table so that the legs hang freely. So, we will locate the patellar tendon directly below the patella. We will deliver a blow with the percussion hammer directly to that tendon. So, we will observe the normal extension or kicking out of the leg as the quadriceps muscle contracts. If no response occurs and you suspect the client is not relaxed, we'll ask the client to interlock fingers and pull. So for the Achilles reflex, this will test the spinal cord levels S1 and S2. With the client in the same position as for the patellar reflex test, we will slightly dorsiflex the client's ankle by supporting the foot lightly in your hand. So, we will deliver a blow with the percussion hammer directly to that tendon. We will observe and feel the normal plantar flexion or the downward jerk of the foot. Ma'am? Also for the other. Thank you, ma'am. Then for the plantar or Babinski's reflex, which is superficial, it might be absent in adults without pathology or overridden by voluntary control. We will use a moderately sharp object such as the handle of the percussion hammer, a key or the dull end of a pin or applicator stick. So, we will stroke the lateral border of the sole of the client's foot, starting at the heel, continuing to the ball of the foot, and then proceeding across the ball of the foot toward the big toe. So, we will observe for the response. Ma'am, can you... For the other side. Thank you, ma'am. So normally, all 5 toes bend downward. This reaction is negative Babinski's. In an abnormal Babinski response, the toes spread outward and the big toe moves upward. So for the motor function, gross motor and balance test, which is the walking gait, so we will ask the client to walk across the room and back and assess the client's gait. So, ma'am, can you walk from this point to that point? Go back. Thank you, ma'am. This is to detect if client has poor posture and unsteady, irregular staggering gait with wide stance, which bends leg only from hips, has rigid or no arm movements. So, for the Romberg's test, we will ask the client to stand with feet together and arms resting at the sides, first with eyes open, then closed. So, ma'am, can you stand up? First, with the eyes open. So, next for the closed eyes. So, ma'am, can you close your eyes? Thank you, ma'am. This is to assess if client cannot maintain foot stance. So, next, standing on one foot with eyes closed. So, we will ask the client to close eyes and stand on one foot, then the other. So, we will stand close to the client during this test. So, ma'am, can you stand up? Can you stand on your one foot with your eyes closed? Also to the other foot. Thank you, ma'am. So next, this will assess if client cannot maintain stance for 5 seconds. So for the heel-toe walking, we will ask the client to walk a straight line, placing the heel of one foot directly in front of the toes of the other foot. So ma'am, can you do this when you walk straight? And also for when you go back. And go back. Thank you, ma'am. This will assess if the client cannot maintain heel-toe walking along a straight line, or she assumes a wider foot gait to stay upright. So for the toe or heel walking, so we will ask the client to walk several steps. So ma'am, can you walk with your toes to that point like this? And for when you walk back, can you walk with your heels? And go back with your heels. Thank you, ma'am. So this will assess if client is able to walk several steps on toe or heels. So for the fine motor test for the upper extremities. So finger to nose test. So we will ask the client to abduct and extend arms at shoulder height and rapidly touch nose alternately with one index finger and then the other. So we will have the client repeat the test with eyes closed if the test is performed easily. So ma'am, can you spread your arms like this? And can you do this? So ma'am, can you point your nose while I say which arm will you point your nose? So right, left, right, left, right, and then then close your eyes. So left, right, left, right. Thank you, ma'am. This will assess if client can repeatedly and rhythmically touch the nose. So for the alternating supination and pronation of hands on knees, we will ask the client to pat both knees with the palms of both hands and then with the backs of hands alternately at an ever-increasing rate. So ma'am, can you do this when I say down and then open? So, up, down, up, down, up, down, up, down, up, down, up, down. Thank you, ma'am. This will detect if client can either neatly supinate and pronate hands at rapid force or performs with slow, clumsy movements and irregular timing. So for the finger to nose and to the nurse's finger, we will ask the client to touch nose and then your index finger, held at a distance at about 45 cm at a rapid and increasing rate. So ma'am, can you touch your nose and to my index fingers? So touch your nose and my index fingers. Okay, touch again your nose and my again. Thank you, ma'am. This will assess if client can perform accurately and coordinated. So for the fingers to fingers, we will ask the client to spread arms broadly at shoulder height and then bring fingers together at the midline, first with eyes open and then closed. First slowly and then rapidly. So ma'am, can you spread your arms like this and point at the midline with your arms like that. Yes. Spread, then point, spread and point, and spread and point, spread and point. And also with your eyes closed, can you then spread, point, spread, point. Thank you, ma'am. This will detect if client can perform accurately. So, in fingers to thumb, with the same hand, we will ask the client to touch each finger of one hand to the thumb of the same hand as rapidly as possible. So, just like what we did earlier, ma'am, but with your thumb. So, can you like this? And, yeah. Spread, point, spread, point, spread, and point. And with your eyes closed, spread, point, spread, point, spread, point. Thank you, ma'am. Then next, this client should rapidly touch each finger to thumb with each hand. So for the fine motor test for the lower extremities, we will ask the client to lie supine and to perform this test. So for the heel down opposite shin, we will ask the client to place the heel of one foot just below the opposite knee and run the heel down to shin to the foot. Then we will repeat with the other foot. Then the client may also use a sitting position for this test. So, ma'am, what would you prefer, laying down or sitting?
Sitting.
Thank you, ma'am. So, can you execute this, ma'am? Where you're down to your toes and to your other side. Thank you, ma'am. For the toe or ball of foot to the nurse's finger. So, we will ask the client to touch our finger with the large toe of each foot. So, ma'am, can you touch my index finger with your big toes? Thank you, ma'am. So, for the light touch sensation, we will compare the light touch sensations of symmetric areas of the body. So, we will ask the client to close eyes and to respond by saying yes or no whenever the client feel the cotton wisp touching the skin. So, with a wisp of cotton, we will likely touch one specific spot and then the same spot on the other side of the body. This will test areas. We will test areas on the forehead, cheek, hand, lower arm, abdomen, foot, and lower leg. We will also check a distal area of the limb first. So, ma'am, can you close your eyes? And can you say now or yes when you feel a cotton wisp touching your parts of the body?
Yes. 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 Yes.
Thank you, ma'am. Then, next, we will also make a sketch of the sensory loss area for recording purposes. This will assess if client has any difficulty in sensation. For the pain sensation, we will assess pain sensation as follows. So, we will ask the client to close his or her eyes and to say sharp, dull, or don't know when the sharp or dull end of the broken tongue depressor is felt. So, we will alternately use the sharp and dull end of the sterile pin or needle to lightly prick designated anatomic areas at random. So, the face is not tested in this manner. We will allow at least 2 seconds between each test. So, ma'am, can you close your eyes? And can you say when sharp object is pricking you or the dull? So, we will begin.
Sharp. Dull. Dull. Sharp.
Thank you, ma'am. So, this will assess if the client is able to differentiate sharp and dull sensation. So, for the temperature sensation, we will touch skin areas with test tubes filled with hot or cold water. So we will have the client respond saying hot, cold, or don't know. So since we don't have a test tube, so we will assume that these are test tubes. So ma'am, can you close your eyes and can you differentiate if this is cold or hot? So ma'am, can you raise your hands?
Cold. Hot. Cold. Hot.
Thank you, ma'am. This will assess if client is able to differentiate between hot and cold. So, next, for the position or kinesthetic sensation, commonly the middle fingers and large toes are tested for the kinesthetic sensation. So, to test the fingers, support the client's arm with one hand and hold the client's palm in the other. To test the toes, place the client's heels on the examining table. So we will ask the client to close his or her eyes, then grasp a middle finger or a big toe firmly between your thumb and index finger and exert the same pressure on both sides of the finger or toe while moving it. So move the finger or toe until it is up, down, or straight out and ask the client to identify the positions. So ma'am, ma'am, can you, for this test, you will close your eyes and can you determine if your fingers are up, down, or straight? So ma'am, so we'll begin.
Up. Down. Straight. Up. Down. Straight.
Thank you, ma'am. This will assess if client can readily determine the position of fingers and toes. So for the tactile discrimination, for all the tests, the client's eyes need to be closed. So 1 and 2 point discrimination. So we will alternately stimulate the skin with 2 pins simultaneously and then with 1 pin. We will ask whether the client feels 1 or 2 pin pricks. So ma'am, you will state if you feel 1 pin pricks or 2 pin pricks. And can you close your eyes?
1, 2, 1, 2, 2, 1, 2, 2, 1.
Thank you, ma'am. This will assess if client can distinguish a 1 and 2 point. So for the stereognosis, we will place familiar objects such as a key, paper clip, or coin in the client's hand and ask the client to identify them. So, ma'am, for this assessment, you will also close your eyes and you will identify what object is in your hands. So, ma'am.
A key. A coin.
Thank you, ma'am. If the client has a motor impairment of the hand and is unable to manipulate an object, we will write a number or letter on the client's palm using a blunt instrument and ask the client to identify it. This procedure will detect if client can either recognize common objects. For the extension phenomenon, we will simultaneously stimulate 2 symmetric areas of the body such as the thighs, the cheeks, or the hands. So ma'am, can you close your eyes and can you state which body part I touch? Ma'am, close your eyes.
Head. Cheek. Neck. Arms.
Thank you, ma'am. This to assess if client can both feel the points of the stimulus. Next and lastly, we will document findings in the client's record for our baseline purposes. So that would be all. Thank you.